we're here again with Pat McGuigan. Thanks for joining us this morning.
Sure.
So an issue you've been following, there's actually a legislative task force that's looking at tax policies. What exactly is this task force charged with doing?
They're looking at a number of the state's tax exemptions, tax credits that have been deferred since last July through next June, the end of June, so for a 2-year period. And whether or not those ought to be restored. Right now they're, suspended. They're in suspended animation. They face a deadline of the end of this year to prepare a report, and it's not only legislators, there's actually some other state officials, the treasurer, for example, and the finance director. And their job is to come up with recommendations on which ones to keep and which ones to let to go away. They're studying very carefully the positive economic benefits, or maybe there's not a positive economic benefit, or that outweighs the cost to taxpayers. So they looked, beginning Friday, they looked at both historical preservation or renovation tax credits and also the tax credits that go to the insurance industry. It's just the beginning, though, of a long, hot summer, if you will, that will actually go until November debating these issues.
What recommendations do you see on the horizon for this?
Well, I think that transferability, that is the ability of a company that gets one of these incentives to sell it to another party, another business, I think that's very much in play, because the argument that Representative Dank, who chairs the committee, and others make is that undermines the economic purpose that's to be achieved through a tax credit or an exemption. I think that's in play. There's going to be a lot of discussion on trying to burrow down and specifically define the public purpose that's served by an incentive or an exemption.
Now, if you had a crystal ball, what changes do you think will occur as a result of this?
Let me say this. I made some notes because you heard a lot of terms in this hearing: offset, exemptions, reserves, bailout, expenditures. Those are all, in essence, synonyms for the word tax credit. I think we're going to all understand that a little better, so that's one change. There might be some drive to eliminate transferability, and I do think that at the end of the day, some of the exemptions themselves will entirely disappear after the legislature finishes its work next year based on this group's recommendations.
It's something kind of completely different that you've been reporting on, a doctor shortage in Oklahoma. How is this going to affect Oklahomans?
Well, it's all tied in with the implementation of the new federal law. Although the primary care physician shortage has existed for many years, it's going to be a very difficult issue, because under the new provisions, 250,000 more Oklahomans become eligible for Medicaid and therefore enter the the insurance pool. This is going to put a real stress on the system. Now, there's two contending arguments. One side says that's good because more people will be insured. The other side makes a very strong argument that mandates like this are going to drive up costs to the insurance companies, and yet they can't charge for the difference in the cost of covering people more than 3 times, for example, the standard cost in order to cover a pre-existing condition. There's a lot of other provisions that could really drive the primary physician issue getting even worse in the state.
Any idea on how this can be solved?
Well, on one side, the argument is made by folks at the Oklahoma Council of Public Affairs that you need to let the market work, and you can tinker with the market and adjust it, but let the market work, at least market incentives. On the other side, groups like Oklahoma Policy Institute say, no, let's let Obamacare, as some people call it, let's let it go into effect, because more people will then be insured and we can begin to address our health problems. The problem is that do we really have a market? Do we really have insurance, or is it transfer of payments? The argument is made by some very knowledgeable people that there's enough money in the system to cover the health care needs of Oklahomans, but it gets spent on things other than health care. For example, cost collection, getting your benefit if you're an insurance company paid. So this is going to be very challenging, and I can't necessarily predict what the outcome will be. I will say that is health insurance a right or is it a privilege? That's part of the argument here. There was a time that we kind of considered it a privilege. Now it's become to be considered a right. Can we afford to pay for that?
And you have a lot more on both of these issues on your website, and you can check that out on CapitolBeatOK.com. Thanks for joining us.
Sure.